So it turned out when we looked at the chemical structure of ONC201, which is shown on the slide, there were no other derivatives out there in the public domain. So ONC201 was the only compound that had, especially this particular triheterocyclic core structure. And what you'll hear about a little bit more later in the presentation is that this novel triheterocyclic core structure turns out to be extremely important for the function of the compound, both its ability to kill cancer cells as well as engage GPCRs. So what we've been able to do is take advantage of that novel scaffold that's there and decorate different chemical moieties around that three-membered ring to come up with a novel chemical class of compounds that we call imipridones based on that chemistry. So the integrity of that core structure is very important for function, but that leaves these peripheral rings hanging off of this scaffold open to more derivative efforts. And it turns out if we decorate those peripheral rings with different chemical entities, we can tune both the specificity and the potency of imipridones among the GPCR superfamily. And this is important because it allows us to think about imipridones being able to engage things beyond just DRD2. As I think will be touched on later, GPCRs are the largest family of membrane receptors in humans.
And essentially 184 GPCRs, which represents about half of all that were known as the endo-GPCRs, which are the ones that respond to endogenous hormones, neurotransmitters, peptides, proteins, and the like, are increased and significantly expressed in at least one type of cancer. 70 GPCRs show increased expression in 4 more types of cancers. Most of these we can confirm if we get cancer cell lines that are available from these cancers. We've been able to confirm virtually all of them. In nearly all cases, the highest expressed GPCRs in the tumors has higher expression in the cancer cells, and they're often more highly expressed than in all of the normal tissues that they're being compared with. And I would say, just off the top of our heads so far, when we've looked at the list of the compounds that the imipridones seem to be working on, this company's working on, we find multiple GPCRs are targeted by them that have higher expression in the tumors.
GPCRs are involved in cancer initiation. That hopefully you will agree with me. But extremely well known, many of them are also involved in metastasis. CXCR4 will be the typical example. Tumor-induced angiogenesis, there are many that are involved in tumor-induced angiogenesis. Work specifically from his lab, that many of these GPCR can be involved in resistance to targeted therapies. So that may be an excellent target in some cases to combine with some of the targeted therapies in patients that don't respond. And they are the top candidate or targets for therapies. And in the 2006, when the first time this was reviewed, around 27% of all drugs currently in the market target GPCRs. Right now it's around 33%. And some of the top seller drugs in the market, at least a large fraction of them target GPCRs. Now, this is very familiar to drug development, so it's not a new drug entity. I mean, it's not a new target. And that is the potential now to combine this expertise in GPCRs, role of GPCRs in cancer, with the already well-known ability to drug these receptors using a new family of compounds that may target them in a way that it will be beneficial for the patient, so basically the therapeutic, but at the same time with limited toxicities.